I'm going to discuss the cognitive domain with the preschool age children to gain their interest in the field of nursing. Their understanding of nursing is basically explained when they think of nurses as wearing hats or giving shots. Um, they also thought that the instrument of nursing toys um, was like the stethoscope was a telescope, and they used the telescope on the radio pulse to take D's temperature, and then they used the blood pressure cuff on the forearm of her, and just had some difficulties with that. But that was their whole how they understood how the equipment is used and what it's used for.
So in the second domain of nursing that I'm going to be discussing, I'm going to be talking about the psychomotor domain of nursing. This one really attempts to clarify the meanings and tries to give the population, which again is our children, a little bit more knowledge about certain things, such as in Zach's example where he discussed the equipment. So us as nurses, we know what we use to listen to the patient's heart sounds and lung sounds is a stethoscope. So it was important that Dee stressed to explain or provide them with the actual terminology, which is again a stethoscope, whereas they pictured it in the cognitive field as a telescope. Another example of the psychomotor domain was where the children thought of nursing as just the help of a particular group of patients. So they looked at nurses just being able to help children. So Dee corrected them and said that no, it's not just children. Again, we're trying to provide them with more knowledge. So we're trying to tell them that it's not just children, but we're also looking at elderly people. We're also looking at different groups of people, and we're trying to put this together as a larger community that we're actually going to be able to work with.
Okay, and then the affective domain discusses the patient relationship between the patient and caregiver, and it discusses the feelings and opinions that they have with each other. And the examples in the clip were how I let them use the stethoscope and the blood pressure cuff on me to establish a trust between us, and then I showed them that they could use it on the teddy bear to show that it was okay and it wasn't going to hurt them or anything.